Hi, my name is Sydney, and this is my head assessment. We're actually going to pan the room really quick just to make sure there are no notes. There is no cheating, but please be mindful we are in the room of a teenage boy, and it is quite the mess. So in a hospital setting, it would be much, much cleaner. So first, I'm going to check the chart outside of the patient's room, and I'm going to look at vitals, health history, condition. I'm then going to come in and provide for privacy, and then I'm going to wash my hands. Hi, my name is Sydney. I'm going to be your nurse today. How are you?
I'm good, how are you?
All right, can I see your name tag? And can you tell me your name and your birth date?
Brendan Wiederman, September 15th, 2001.
All right, and now the patient has presented 2 identifiers. Now, can you tell me where you're at?
The doctor's office.
All right, and do you know what date it is?
October 23rd.
All right, and the patient is alert and oriented times 3. So, what brings you in today?
Just a checkup.
Just a checkup? Now, do you have any pain anywhere?
Not particularly, no.
No pain? So, if the patient was presenting pain, we would ask on a scale of 1 to 10 where that pain falls. And then we would use our PQRS-T system and use that to assess the pain and further treat it. So first with this exam, I'm going to start with your cranial nerves to start out with. So have you noticed any change of smell, any difference that you've noticed?
No.
All right, and this is showing that cranial nerve number 1 is intact. Now I see you wear glasses. Do you also wear contacts?
No, I just wear glasses.
Just glasses? All right, and this is when we would use our Schnellen chart, and we would see the alignment and the pupil of seeing on the chart, and this would show that cranial number 2 was also intact. So now, as I find my light, we're going to do the 6 cardinal gazes. All right, so I'm going to have you follow my pen. All right, ready? And since he was able to do that with ease and follow my pen, we are able to see that cranial nerve 3, 4, and 6 are also intact. So now I'm going to put my hands on your TMJ, and I'm actually going to have you open your jaw and close. And this shows in that motion that it was a normal rhythmic motion, that cranial nerve number 5 is also intact. Can you smile for me? Can you frown? Can you puff up your lips? All right, now this shows that cranial nerve number 7 is also intact. So I'm now going to grab my tongue depressor, and I'm going to have you open up your mouth and say ah.
Ah.
All right, and now I'm going to do the gag reflex test. And ah.
Ah.
All right, and now this shows that cranial nerve number 9 and 10 are also intact. And can you shrug your shoulders for me? And unshrug. This shows cranial nerve number 11 is also intact. And can you say light, tight, dynamite?
Light, tight, dynamite.
And this shows that cranial nerve number 12 is also intact. So I'm actually going to have you swing your legs over the bed for me. And stand up. So I'm going to have you put your feet together. And then I'm going to have you look straight up and close your eyes. And the fact that he's able to stand here and remain his equilibrium and his balance, this shows that cranial nerve number 8 is also intact. So you can open your eyes for me, and since we're in the standing position, we're going to look at his spine, and as I'm feeling down, the spine is in alignment. There's no deviations. It's just straight back. The posture is good. And now I'm going to have you walk forward and then turn around and come back. All right, and this showed that the patient's gait and ambulance is normal and rhythmic. All right, and you can sit down. All right, so I'm going to have you put your hands in supination. I'm going to have you put them in pronation. All right, now this shows that this range of motion was rhythmic with each other. So I'm going to have you put your arms out and front circle. Now back circle. And in this range of motion of the arms, it is rhythmic and normal. All right, so I'm going to have you lay back. So now we're going to test the cerebellum. So I'm actually going to have you put your heel on your shin, the opposite shin, and I'm going to have you rub it down your leg. All right, and the same thing with the other side. All right, and now this is a normal finding, and it shows that the cerebellum is functioning at a normal rate. So I'm going to have you grab my fingers, and this is testing the strength. So push against me and pull. All right, I'm going to do the same for your feet. So push against me. And now act like you're driving a car and push down. All right, and then I just want you to try to lift your legs up against the pressure. All right, and strength is normal and good. So the next part of our exam is we're going to look at the overall symmetry of the face. The face is symmetrical. Each side is equal to each other. And we can see that hair is evenly distributed on the head. The skin is warm, dry. The skin color is normal. And so now we're going to look into the hair. These off real quick. And we can see that, and I'm going to palpate the scalp, and it is normophallid. There are no bumps, no lumps, and the hair is clean, evenly distributed. Have you noticed any hair loss?
No.
The patient hasn't noticed any hair loss. There's no lice. There are no bugs. All right. And while we're in this area, I'm actually going to move down to the eyes. So as we're looking at the eyes, they're also symmetric to each other. The eyebrow and the eyelashes have equal distribution on both sides. So I'm going to look at the conjunctiva. Can you open your eyes for me? Which is a nice pale pink color. And the sclera on the cornea. And the sclera is white with no jaundice. So now I'm going to look at the pupil dilation and constriction. So I'm actually going to bring the light in front as consensual and non-consensual as the pupils dilate, all right? Right, and the pupils dilated normally. All right, so I'm going to have you look up in the corner. We're going to test accommodation. So I'm going to have you look up in the corner. And then I'm going to have you look at my pen. All right, and the eyes accommodated nicely. And so now we're going to check the perla of the eyes. And the pupil is round. At this very moment, I'd say it's at a 6. Everything is nice and even. Color evenly distributed. And overall, a very pretty eye. All right, so now we're going to move on to, now you said you wear glasses and contacts?
Yes.
And so your vision's pretty bad?
Yeah.
All right, do you ever have double vision?
No.
Are you colorblind?
No.
All right, and do you ever get dry eye, watery eye?
No.
Okay. All right, so now after that, we're going to move on to the nose. So as we're looking at the nose, from the outside, it is symmetric with each other. There's no evidence of breaking. And as we look inside, it is a nice pink moist inside with even amounts of hair distributed. There's no deviations. There's no swelling or redness or any drainage. And now as we move to the mouth, just from looking at it to begin with, the lips themselves are pink. They are not chapped, cracked, very moist. And I'm actually going to have you smile for me. The teeth are straight, clean. They do have braces on them. And they are relatively aligned with the gums. And as we're looking at the gums are nice and pink. There's no swelling or bleeding. And can I have you open your mouth for me? All right. And as we can see, the tongue is nice and pink and moist. And we can see the subbuccal mucosa is also nice and pink and moist, to be expected. I'm going to grab my tongue depressor real quick so we can view the uvula. I'm going to have you say ah for me. All right, and the uvula is also pink and moist, a very normal finding, as well as the tonsils and the pharyngeal wall are at a grading of +1, as we looked back there. Now, do you ever have any problems with your braces in your lips or your gums, or do you have a problem cleaning at all?
Sometimes I get chapped lips from my braces,
But do you ever have problems cleaning that would affect the health of the gums? Do your gums ever bleed when you floss them?
No.
Okay, well, that's good. All right, so while we are still on the face, we're going to move over to the ear. So as I'm just looking at the outside ear, there is no swelling. It is the normal color of the rest of the skin in the body. So as I'm looking inside, it is nice pink. There is no backup. There is a normal amount of earwax. And I'm actually going to test the tenderness of the tragus, the pinna, and the mastoid process. So if any of these areas are tender, please let me know. So the mastoid process, tragus, pinna. Was that tender?
Oh, no.
All right, and the mastoid process, tragus, and the pinna. All right, have you ever had any hearing problems?
I just had tubes put in when I was a kid.
Do you know how old you were when you had tubes put in?
2.
2? Any other hearing problems? Have you ever had any problems hearing? Have you ever had earwax problems? Have you ever had a ruptured?
No.
No? All right. All right. And so now we're going to move down to the neck. And as we're at the neck, we're going to examine the lymph nodes. And along with the lymph nodes, first I'm actually going to go back and review the sinuses really quick to make sure there's no tenderness there. So I'm just going to push down and just let me know if there's any tenderness. No tenders? So the patient reports there was no tenderness in the frontal and maxillary sinuses. So now we're going to move back down to the neck, and we're actually going to palpate the lymph nodes. And just let me know if anything is tender. And I'm actually going to sit down for this. All right, so the preocular, the postocular, submandibular, submantle, the occipital, the tonsillar, the superficial cervical, and then the deep cervical chain as we palpate down, and then the supraclavicular and the posterior cervical. Was anything tender?
No.
All right, so the lymph nodes were non-palpable and they were not tender. So have you ever had any problems with your neck?
No.
Have you ever had any lymph node problems?
No.
No? All right, so while we're in the neck region, I'm actually going to test, I'm actually going to palpate the carotid on both sides to see if we can feel any thrills. So we're going to do each side on their own so we don't knock them out. So we're going to start with the left, and I'm feeling for thrills as I work my way down the carotid. And as I come on the right side, working down, feeling for thrills. And there are no thrills present on either left or right carotid. So now I'm going to take the bell of my stethoscope, and I am going to listen to the carotid in 3 different places to listen for bruise. So I'm going to begin with the right and then end with the left. Right, and there were no bruise present. So while we're up in this neck area, I'm actually going to do the skin turgor test. And this is to check for tenting in the skin. And there was no tenting, which is a sign of no dehydration. And while I am here, can I see your fingernails? The fingernails are smooth, they are thick and strong, and I'm actually going to do their cap refills on them. And they refill almost immediately and in under 3 seconds. All right, and I'm going to test for JVD now, which is the jugular vein distension. So I'm actually going to remove this back piece, and I'm going to have him lay down on his back. In a hospital bed, this is a little easier. But as he lays down, we can see that the jugular vein actually fills and is distended. And when we move him back into a 45-degree angle, we can see that the fluid rushes out and the vein is no longer distended, which shows a normal flow of fluids. And speaking of fluids, we're going to check his legs for edemas, which is a buildup of fluid. So I'm going to check his legs for pitting. And when pitting is not present, it means there's no edema or buildup of fluid. So there's no pitting evident here. I'm actually going to have you sit up one more time for me. And I'm going to come around the back. And I'm going to check his thyroid. So to do that, you would come behind. And you would palpate the thyroid on both sides, looking for enlargements or goiters, which there are none present. And as he sits back, I'm actually going to palpate his trachea as well to feel for any deviations, which there are none. All right. And he seems like a pretty healthy boy to me. But is there anything else I can get for you?
I think I'm good, thank you.
You think you're good? All right, thank you so much.
Thank you.